FSN Radio. It's all about what's next. Go to financialsurvivalnetwork.com and sign up for your free weekly newsletter. You'll also get 3 free reports. The Financial Survival Network. It's all about what's next.
Welcome. You are listening to the Financial Survival Network. I'm Kerry Lutz, and today is 12/16/2020. Well, big breakthroughs on the vaccine front. The vaccine from Pfizer is shipping 100 million doses, I heard, all around the country, first going to first responders and people in hospitals, nursing homes, etc. Well, is it a good idea? Is this really a breakthrough? Is it really a miracle, as our president proclaimed? Let's get the take from somebody who actually knows what he's talking about Dr. Sal Giorgianni. Dr. Giorgianni, you've been involved in public health, in pharma, and you've got a long career and history with it. So really, past chair emeritus of the American Public Health Association, former Alumni Association board member of Columbia University School of Public Health. So you certainly know from whence you speak. So overall, will the vaccine actually live up to the hype?
Well, I'm certainly optimistic it will. Every day that goes by, Kerry, we see tens of thousands of more people receiving the vaccine in all the countries now where it's been approved under emergency use authorization or their equivalent. That will go right on top of the 100 and some odd thousand people that have been received the vaccine under clinical trial conditions. So we're going to have some real-time data in real people that will be able to measure the efficacy, the safety of these vaccines in the real world. But the data from all the different vaccines that are being studied by all the different sponsoring companies has been amazingly, remarkably consistent, both in terms of how effective it is, if given in the proper way, and in terms of the side effects and safety profile of the vaccine. So the big wild card here is, are people going to get the vaccine in sufficient numbers to develop population immunity, aka herd immunity? I think population immunity is a much better way to say it. B, will we see any unusual side effects that didn't pop up in the 100,000 or so individuals that have received it? And right now, that's not the case. Will it confer immunity for a reasonably long period of time, a year, 2 years, 6 years? We don't know. We'll have to track that. Will there be sufficient vaccine supply, or will we end up with supply issues as we have with some other critical medicines on occasion? So there are still some unknowns, but I do think that right now, if you look back at what was written in August about what the expectation would be for the vaccine rollout plans, it's pretty much what people expected it to be. And that is a very, very good thing. So I'm very optimistic about it.
Okay, so a couple of questions about population or herd immunity. From what we saw in instances where people were confined into small places, like I'm talking about the Diamond Princess, there were 3,500 people there, 20% of them came down with it that we know of, and they were followed up to some extent. Few deaths happened. And probably in a cruise ship that's probably an older population sample, at least among the passengers, than we might otherwise see. Does that mean that there is some built-in immunity, that certain people are immune from COVID?
Well, that is a very important point that folks need to understand. When you give a vaccine and you measure lots of things, one of the things you measure is the antibody response in the body with the first vaccination and then with the second vaccination, and you make a determination if that is effective levels of vaccine. So for the Pfizer, Moderna, and probably for the others that are 2 vaccine protocols, you get about 58, 60 60% immunity protection with the first dose. And then when you get that second dose 21 days later, which is about how long it takes for the vaccine to really pump up the immune system to its optimum levels, you get that second dose and it kicks it up to 90+%, which is where we want to see those targets. When you have a natural infection or you get natural immunity from the virus or whatever you're looking at, you really don't know how much of an antibody response any individual will have. And there are so many variables, how much of a viral load, so how strong, how many viruses, if you will, you inhaled and got into your system, how long your system took to develop an antibody response. Was it a light infection or was it a very heavy-duty infection? How competent is your immune system individually? So there are so many variables to the natural immunity with this virus. We just can't be sure if someone who's had a bout of COVID really has sufficient antibodies to carry them through another exposure. And we have had a couple of cases of people becoming re-exposed and getting full-blown clinical COVID after they had, quote-unquote, a case. So we're really not sure if you're protected with the natural immunity to this particular virus, but we are sure that about 95% of people who get the vaccines are immunologically safe. So that's the difference. So, the next follow-up question I almost always get is, well, should people have had the virus get vaccinated? And the answer is yes, because unless they can show that they have antibody levels of sufficient antibody levels and that they believe it's going to last for a year, 6 months, a year and a half, you really don't know. So why gamble?
Yeah, I can understand that. But about antibodies, isn't there also T-cell immunity and C-cell immunity? And that's a lot harder to measure than antibodies?
Oh, absolutely. The immune system is ridiculously complex, and I'm not an immunologist. And when I had to study that stuff, believe me, it just made my head spin. It looked like something out of a bad horror movie. So, yes, it's terribly complex, and the immune system isn't just one type of cell. It's a whole cascade of cells. But the measurement of the antibodies per se is the best indicator. It's kind of like measuring blood pressure. It doesn't tell you exactly if you're going to die of a heart attack, but it's what we refer to as a surrogate marker. It's not the marker, but it's a good surrogate marker for potential for cardiovascular disease, measuring blood pressure. Same with these antibodies. It is not the marker or the markers, but it is certainly a very good surrogate marker.
All right, that seems to make sense. So you think the potential fears of side effects of the vaccine is pretty well overblown, huh? Well,
people have a right to inquire, and I am a strong proponent that folks should know what is going on with something that they're going to have in their body. I think some of the rather irresponsible rhetoric out there is there to cause chaos from political and economic rivals to our society and other societies, and people have to be able to sort through that. So I don't know that I would say it's overblown. I would say that it is very comforting to know that the side effects we are seeing both in the clinical trials and now as we start rolling it out to tens of thousands of people a day, in Western countries where good data is being kept, seems to fit the profile of every vaccine from measles, mumps, rubella to shingles to seasonal flu. It's not much different. So that I think is, the rubber meets the road, and that's right. The proof we need.
You think there's been adequate testing of the vaccine? You can feel secure that there's probably not going to be any big surprises on the horizon?
Well, there's adequate testing of the vaccine, more than adequate testing of the vaccine by multiple sponsoring companies that's been scrutinized by internal scientists, by federal scientists, and by independent scientists who all come from practice and academia. So these things have gotten an awful lot of scrutiny. If there's going to be something that was not anticipated, well, it might be. Nothing is 100%, and we just don't live in a zero risk society, even though people would like zero risk. I think the way we look at it is more than acceptable levels of risk.
So it's an acceptable level of risk. Now, what about the progress on the therapeutic front? We've seen people like Chris Christie, who's a walking compendium of comorbidities. Literally, he marched out of the hospital, in less than a week. Rudy Giuliani, the president. What kind of progress have we made on the therapeutic front?
FSN Radio. It's all about what's next.
Doré Copper Mining is a premier, near-term, high-grade copper and gold redevelopment opportunity with tremendous exploration potential only 14 kilometers from the town of Chibougamau in mine-friendly Quebec. Doré Copper is debt-free and owns a 2,700-ton per day mill with an 8 million-ton tailings facility ready to be used. There is already power to site and it is accessible by paved highway and rail. Doré Copper aims to produce a profitable hub-and-spoke operation of over 100,000 gold equivalent ounces per year or over 60 million pounds of copper equivalent by 2024. Because of the existing infrastructure and location, a low capex is anticipated to recommence production. Doré Copper trades under DCMC in Toronto and under DRCMF on the OTC. To learn more, go to dorecopper.com. That's dorecopper.com.
The Financial Survival Network. It's all about what's next.
Tremendous progress, Kerry. Here too, the scientists and pharmaceutical industry and government labs and academia, they have to be given some tremendous credit for moving the needle on how to diagnose, how to stratify different patient types for COVID risk, and how to typically look at the course of the disease. And it's not just giving a drug at times, it's also the right time to give the right drug. So it's very complex algorithms that have to develop. And they were done within 8 months. So what we know now about treating COVID and the 5 different sort of tiers of COVID infection that need to be and when to give things is amazing light years ahead. Remdesivir, the Eli Lilly product, they're like autoimmune systems in a tube. The use of very old medication, dexamethasone, which is a corticosteroid that costs maybe $3 a day, as an augmentation effect, and then other new drugs. We've learned so much now. And that's why I think I'm also encouraged. While the death rate is still horrific, it makes your skin crawl when you really, really sit down and think about it. It could have been so much worse if folks in the scientific and medical community didn't attack this as robustly as they did.
Yeah, and a lot of other drugs, some of it controversial, like hydroxychloroquine. We heard just yesterday the FDA took off their prohibition, said it can be used to treat COVID. I think it's ivermectin or something like that, really effective, and probably several others. Well, why haven't the authorities said, the health authorities, encourage people to take vitamin D and zinc, which have been shown that in, I think, 80% of the COVID-affected patients, they've been low in vitamin D. Now, we can't perhaps definitively establish a link in the deficiency to the actual onset of the disease, of the virus, but the evidence so far has been pretty compelling, hasn't it?
Well, what you said is absolutely correct. And I and my wife and my kids all take extra vitamin D. Most people don't get enough of it, particularly in the winter months when we're outside a lot. So, but when you look at the call of something being evidence that most non-medical people would ascribe to something, what medical people and in particular regulators call it is observation. So it's observational data. No one has really studied the impact of this dose of vitamin D or that level of vitamin D and the correlate to whether you get infected or how severe the infection. There hasn't been a systematic study with sufficient levels of data for the government regulator to make the call. Yeah, you got to take vitamin D, 5,000 units every day, and you got to get your vitamin D levels up to a certain point. There hasn't been that systematic, rigorous study. They've been much more focused on, as we just spoke about, getting a vaccine and getting therapeutic treatment. So same goes for zinc. There's whole body of observational information that zinc works. I think it does. So I have some zinc sitting around in the house, and the first sign of any kind of little respiratory issue, we all jump to the zinc counter. We jump to the zinc tablets. That goes along with what scientists and regulators must see and be able to rigorously analyze before they make a hard recommendation, and what most people think is good common sense approach. So I do think you should take your vitamin D, and if you can tolerate it, not everybody can, utilize zinc.
Yeah, I know it makes me a little nauseous when I first take it in the morning, but I've been taking it, vitamin D, for 10 years because when I first moved to Florida, got a blood test, and I actually found out that I was vitamin D deficient. Had no idea about it. I always thought I got enough sun, but in New York, half the year you're indoors. And I found, mood-wise, it supposedly can affect your mood. It's all anecdotal. But as a general thing, people should be taking vitamin D anyway if you have a deficiency. In England, the NHS there is actually sending out vitamin D gratuitously to elderly patients and those patients they deem most at risk of getting COVID. So it can't hurt you. It might help. Probably a good idea to take it.
Too much vitamin D can hurt. You have to take whopping doses. The quote-unquote therapeutic dose of vitamin D is 50,000 units, 50,000 units once a week for several weeks. And the usual amount of vitamin D most people take is about 5,000 units a day. So, there's a big spread there.
Yes,
and
of course.
There's some interesting studies that show some people just do not tolerate these zinc supplements, these herbals, and they end up losing taste for a significant period of time. I don't know that it's been documented that it's lasts forever, but you can lose your sense of taste with zinc. So, you got to be careful with everything. It says my grandmother, the 99-year-old Sicilian woman, would say, everything in moderation.
Yeah, of course. And if something can't hurt you rather, but has a chance of helping you, might make sense to take it. And maybe the government should have been a little more proactive about it and with specific guidelines as far as dosages go, because yes, everything is toxic in excess. I just remember the tests of the white lab rats during the 60s with cyclamates, and they gave them like twice their body weight daily. And amazingly enough, the little rats caught cancer. Who would have thought? So everything is bad for you when you have too much, and that goes for any substance. Food, water can kill you. People have died of water overdoses, right? I mean,
exactly.
But if somebody walked into your office, doctor, and said, I'm thinking of taking vitamin D and zinc, you would encourage him, if I'm not correct, and express the concerns with too much and the potential side effects of zinc, right?
Sure. And I think that's what my general guy's comment would be. We have a lot of information out there. Some of it is absolutely awful. Some of it is designed to be misleading. And much of it is correct. But we're very fortunate. We have physicians, nurses, pharmacists who are very up on all of this. I don't know anybody who has not been keeping up with all the information, maybe not as intensively as I do on a minute-by-minute basis. But, talk with one of these healthcare providers. Go down to your local pharmacy, talk to the local pharmacist if you can't get an appointment for a medical visit. Folks have nurses in their family, well-educated RNs and nurse practitioners, physician's assistants. So there are a lot of folks that we come in contact with all the time that can not only just tell us and give us a learned intermediary opinion, but that we can trust that they're not going to be telling us false narratives. Now, having said that, I know some physicians feel that this is bogus and all of this we're making too much of a big deal. I think you have to take that most uncommon commodity, common sense, and apply it to what you're hearing. And if it doesn't make sense, it's probably not right. And you should confirm it. But I do think we have a lot of very intelligent people that we have a lot of access to in this country that we can have a conversation with about something as important as this.
And I agree with you. One final question. It's kind of a multiple question.
Okay.
Lockdowns and masks, right? It appears to me there's very little science to support lockdowns, that their effects are unknown, because we can kind of use the places, states, countries that didn't do lockdowns as a control group, and they don't seem to be any worse off for the lack of a lockdown. And the other thing is masks. It seems to me from my studies, and I've looked at a lot of studies, very inconclusive that they prevent anything other than an N95 mask, properly fitted and properly disinfected at the right intervals. I don't see masks, being the be-all and the end-all. Are we deluding ourselves? Is wearing masks like going to an airport and thinking that the TSA is going to protect you?
Yeah, that I will say that I do believe that social mitigation techniques are extremely important, particularly in the earlier phases of this pandemic, where we didn't know what we were dealing with. And that's the analogy I sometimes use when we had those planes crashing into the World Trade Center. We didn't know what we were dealing with in the first several hours or days of that horrific event, and people did, I think, the right things. They became, overcautious and instituted a lot of things which may or may not have been necessary. And then we continued some of them which are necessary and some of them which are not necessary. So I think the same thing happened with this pandemic. We didn't know exactly what we were dealing with. And to some extent, Kerry, we still don't know. We're still seeing this COVID virus appearing naturally in animals, in minks. So we still are not 100% sure what we're dealing with. So I do believe that common sense dictates that you hand wash, that you stay away from individuals where you could get sprayed with, if you will, the moist droplets that come from speaking or singing or coughing. You need to stay at this distance away. Most people take it at 6 feet. Some people will tell you 12. I think 6 is fine. If you wear a facial barrier, then you are just blunting the ability for that spray to go out. And that again, is just a common sense sort of thing. It has to be a barrier that's not so porous like these silly face coverings that people wear that look like Bandito masks from the Dorito Bandito. I think that you're just fooling yourself. And it will not completely protect you, none of those, except a true N95 setup or a respirator. They will not protect you from getting the virus, but they probably are doing an extremely good job in lowering the viral load that you get. So you might get one virus instead of 20 million viruses if you're wearing an appropriate facial protection and wearing it right. You just can't have it hanging around your chin and then put your face within 2 feet of someone else's face who's talking at you and expect to be protected. Before I was coming out, I was just talking with a nurse about that, and she's relating that even physicians in her hospital are hanging their masks around their chins. You're just fooling yourself. So again, I do believe that some of our political leaders and some of our managers and businesses have taken things a little too far without much common sense applied, or with illogical restrictions in terms of times or places or activities that should be cut off and activities that are allowed. I think that is terrible, where we've got to get past this initial phase. And then I think people have the right to question the decision-making and whether folks held on to this needed extreme set of restrictions too long because they just got comfortable with exercising an over amount of authority over individuals.
Yeah, isn't that the truth? Well, Doctor, really appreciate you coming on and sharing your experience and knowledge with us. Is there a place we can go to on the website to find out more about you and check out your writings?
Well, Men's Health Network is the organization I generally said that I'm representing. Men's Health Network is the longest general advocacy and education organization, not-for-profit organization that advocates for men, boys, and their families. We have a lot of great information about this and other conditions affecting men at www.menshealthnetwork.org, www.menshealthnetwork.org.
All right, we got that down now. That'll be in the show notes, and go over there and take a look. Any questions, comments for the doctor or myself, please send us an email, kl@kerrylutz.com. Our Twitter feed's @KerryLutz, Facebook page, Financial Survival Network, and sign up for your free newsletter at financialsurvivalnetwork.com. Doctor, thanks so much for coming on and educating us, because I think that's our best defense.
Absolutely. I'd be happy to do that anytime that you need.
FSN Radio. It's all about what's next. Go to financialsurvivalnetwork.com and sign up for your free weekly newsletter. You'll also get 3 free reports. The Financial Survival Network. It's all about what's next.